Hello, dummies. I'm here again. It's the worst political podcast that's ever existed. I am exhausted. Hate intros. I've decided that I'm calling all you people that listen to this. There's a surprising amount. I've been getting some really good feedback about being an idiot. But yeah, you're all my politiots. Politiots and politiettes. That's what I'm calling you. And I know it's cringe because it's gay. And all of this is gay. I'm having a rough week. I'm really, really exhausted. This has been one of the longest weeks of my life right now. It's going into the worst time of the year, so everything's backlogged. Everything sucks. I'm probably getting sick. So what I need from all of you is to go over to the new YouTube page, Politiocracy. Go subscribe. There's already 60 some odd of you already there, so go. Let's get to 100 by the end of the year. That's the goal. It's not a big goal, so let's make it happen. But I have a question. Most important thing going on. I feel lost, and I feel like most people feel like this in Canada. I don't know what it means to be Canadian. I would like the answer to that. If anybody could answer that down in the comment section anywhere that you can, send me a DM. What does it mean to be Canadian anymore? There used to be like a trope. There used to be like online quirks. Like I feel like if you ask somebody outside of Canada, they would say the same thing that people used to say like 10, 15 years ago, that it's like we're beaver trapping, Molson drinking, hockey loving, toque wearing, bagged milk drinking, polite people. But I don't feel that anymore. I don't know what it is. If you want to say that we're a melting pot society where it's just a bunch of people that ignore each other and they don't really interact with each other, they don't understand each other, because that's what it's starting to feel like. I don't know what it means to be Canadian anymore. I would like to know. I would like it to go to something, whatever it can be. It can't just be everybody does what they want and we don't associate with each other. I don't like that. I don't really appreciate that. But playing off of what we talked about last week, one of the main points that I talked about last week was this new asylum seeking program where you can just go on your phone on an app and then you gain access to the country. You are now, for all intents and purposes, a citizen of the country. You get subsidized money from the government. You get places to stay. You are an asylum seeker from another country. Maybe you were persecuted or whatever, but that used to be a thing about Canada, where we used to just let in people and we used to be a very accepting society. And then it hit a tipping point where people started to abuse that program, and now we cannot employ enough people in the government to keep that afloat. So I looked a little bit more into this, and it seems like the border security agency in Canada, where they're supposed to keep track of all of this, have had a backlog of cases. It's not just the people who are running the background checks and are supposed to be keeping track of the people that are seeking asylum for the country. They could just get in. I looked up what's going on, and it seems way more dire than people are understanding. So the border security, what exactly is it called? It's called the Canadian Border Agency Security. They are supposed to be keeping track of all of these people, and they're supposed to be hunting down the people after they've gone through their app and they've typed in whatever thing that they need to say that they're not a terrorist to enter the country. Then that's supposed to go to an actual case that's reviewed, and they're supposed to follow up with these people, and then they're either approved or denied after the fact, once they're in. Now, we found the flaw with the system. So out of the 50,000 asylum seekers that were not approved, they went through the system. There are hundreds of thousands of people getting in. But then, and honestly, I don't think we're keeping full track of it. The number might be way deeper than that. But there's 50,000 that have definitely been not approved by the CBSA. And they now can't find these people. So 50,000 were not approved this year, and they were supposed to be deported. Well, America has like help wanted ICE agents that just go out there, and anybody's uncle can go in there and get a $50,000 signing bonus, and they're deporting people. Canada can't seem to find the 50,000 that are supposed to be not in this country. And out of the 50,000, they got 9. They got 9,000 of them. And they're working on 15 or so. And there are 34,700 asylum-seeking people that came into the country that are just lost, and nobody can find them. So they're gone. We have no idea where they are. I don't know what's happened to them. Nobody really knows. They're just in the wind, and they could be anywhere at this point, and they'll never leave, because why would they? They've gotten a free access, free ride into the country, and now they're here. Where they go is not our problem, because we're never going to find them. So I don't know what the solution to this is. Actually, I guess I do. The solution is don't let people in on an app. That it seems pretty self-explanatory. Don't let people self-report. If we didn't let people self-report for COVID, they needed to show proof of a vaccination, then why would we let people self-report for asylum claims? Because do you not see I think we need to start building systems from a place of how would this be taken advantage of, and work backwards, not how can we appease the most amount of people. Because although that seems like the best place to go from the good place in your heart, it's not right, because inherently people will abuse the system, and we need to make it abuse proof before we could just start opening the floodgates and letting people in. So that's a very concerning number. And the amount of wow. See, I'm exhausted. I can't even say the word refugee anymore. The refugees and asylum seekers in this country are getting out of hand. I don't know what we're supposed to do to control this. But on a funny note, because it seems like when you go out onto the street, you ask people, should we be letting asylum seekers into the country? All the good-hearted Canadians, the oh, I'm sorry, buddy, Canadians out there are saying, absolutely, we should let them into our country. Sight unseen. They need help. They're in a war-torn country. They're in a country that just, doesn't really like them. Maybe they're gay in Russia. Maybe they just don't like the scenery where they're at. Then let them in, because we have so much land and so much opportunity here that you should just absolutely let them in. I don't see the problem with that. Now let me get started. Let me tell you the problems. This is all going to come together and make a lot of sense. There's a lot of problems with that. We don't see the problems immediately, but this will all come together when I present all the facts to you. But first, somebody did that exact thing. They went on the street and they asked people, do you think we should be letting refugees into the country? And all of them said yes. So here's a little interview with some of the people on the street, and here's what they had to say.
Should help refugees by opening their homes?
Definitely. I think they should.
And do you think personally, would you ever be willing to house a refugee?
Depends how many.
Yes, definitely. And we're proud to be a Canadian because of that.
Yeah, sure.
Yeah, why not? Why not? Everybody needs help.
We actually have someone here today that we are looking for a home. This is Mo. Do you think that Mo would be able to go home with you today?
Well, not right off the bat.
Unfortunately, we have only one bedroom. There's a lot of opportunity here around. For sure, he will find something that can help him.
Do you think Mo can find a home with you guys?
Probably not with us.
Would you guys be able to house him?
Not immediately, but we will definitely consider about that.
Do you think...
Oh, isn't that funny? Why wouldn't you want these people to come into here? Why wouldn't Mo fit in with your family? Why couldn't you let Mo into your home? Maybe you'd want to know a little bit about him. Maybe you would want to check out what he's about, get to know Mo, maybe see what his opinions are, maybe if he's going to fit into your tapestry of your family. Or should you just let him on sight unseen? Should he just fill out his own form and come right into your house? You got an extra bedroom. You got a couch. There's probably room for Mo. Doesn't take up a lot of space in your house, so why not? It's not that bad to let Mo in. He needs the help. He's a refugee, and why shouldn't you help him? Maybe it's because you can't afford to feed your family. Maybe it's because when you go to the hospital, it's impossible to be seen. Maybe it's because you can't get a doctor. Maybe it's because the stagnant wages. Maybe it's because you can't afford to buy a home. Maybe it's because the birth rate is on a serious decline and you can't even afford to have a child. Maybe it's all of those things. And do you think there's some sort of correlation between letting in all of these people into the country and then not being able to afford anything? Maybe social services are being spread too thin over people that weren't supposed to be here in the first place. That seems pretty funny. Pretty ironic, I would say, is that you won't let Mo into your house, but we should let him into the country because he just needs it. Of course we should. We're Canadian. There's lots of opportunity here. Then why doesn't it seem like anybody has opportunity? Why? Why is that the case? Jesus Christ! And I've hit a wrong button. There we go. So why are people so blind when they're seeing it on a grand scale? They think the government should be able to handle this when you can't handle it on a small scale. Because at the end of the day, the government is just as dumb as you. They're filled with idiots like the rest of us. You think that they're some sort of omnipotent... Wow. Jesus Christ, Ryan. Use correct words. They're big brain smarty peoples, and we're small dumb small people that can't figure out things. The government has infinite money. They take 40 some odd % of your tax dollars. Every a quarter to half of the year of your working year is given to the government. They have all the money in the world. They should be able to house these people and figure it all out. They can't house and support the people that are already here. So how is that going to be possible? Because nobody seems to know what it even means to be Canadian anymore. You can let yourself into the country. You can be whatever you want to be. You don't have to assimilate. You barely have to speak the language. Nothing really makes sense anymore. So how do we possibly fix this if we just continue to go on the path that we're on? Nobody seems to want to change it. They seem to just want to expand it. They want to add more, and that shouldn't be the case. We need to fix this. We need to stop things. If we can't security check, a basic security check for people that are coming into the country from even under their own admission, a country that's not in the best circumstances, why would we let these people in if we can't fix our own problems? There are acres and acres of homeless people sitting in city landscapes, outside of city halls, in your public parks, every single place that you look, and we can't afford to do anything about it. So we have our own refugees and asylum seekers that are laying down in front of your local McDonald's. They're lined up at the methadone clinics. All of these people are not in great circumstances, and they need something to fix it. So why can't we fix that first? It only makes sense. This is the best analogy that I've ever heard. If I've had my house foreclosed, you're not going to expect me or be upset with me if I don't give you a Christmas gift. That's the way that we should be looking at this, is that if our own world is falling apart here and we have an insane amount of the homeless population and people that can't afford, the amount of people that are using food banks, and last week we talked about the services that are given to schools now because children, their parents, can't afford to feed them anymore. We need to pay billions of dollars to schools to feed the children because their parents can't anymore. What if we stopped taxing those people and maybe they'd have more money to feed their kids? Maybe we wouldn't have to supplement people that are coming into this country under their own admission that they don't even understand what's going on. They don't understand the system that's going on here. They just see it on TV. I don't exactly know why they want to come here anymore. If you were on the inside looking out, you wouldn't want to be here, because the only way that I think honestly at this point, the best solution for a Canadian that's struggling right now is to move to Syria and then come back in as a refugee. Say, well, I was a refugee from Syria. I'm struggling in this war-torn society, and I need help. And then you'll get something around $8,000 a month to live. And I don't know about you, anybody out there, $8,000 a month would be an improvement from where I'm at. So it's very upsetting. So now that I've taken that route, I'm going to take a left turn here. There's a lot of people online right now talking about Bill C-3. Now, Bill C-3 is presented by the right-leaning news organizations in Canada, as few and far between as they are. But there's a lot of people online talking about how this is going to ruin what it even means to be Canadian. How you can just be born in a completely different country and still gain citizenship to Canada, which seems like the opposite approach. It used to be, even in America, where you have a person, even if they aren't an American citizen, have a kid in America, and that person is gained citizenship, or close enough. They're gained permanent residency at the very least. Now, I don't think people realize this. Now, you have to look into these things before you just read the headline that you see on Instagram or whatever, that this new bill is actually fixing the problem that we already have. So as it stands before this bill, because this bill is already passed, Bill C-3 is already passed, and people are up in arms about it. Because what the claims are online is that because of this bill, you can now gain citizenship for your kid even if they are born outside of the country. So somebody from India can come here, gain citizenship, move back to India, have a kid there, and that kid is now Canadian. What we don't realize is that's already the case. That's how it works already. It's actually much worse than that. What can happen is you can be a Canadian citizen, barely have any connection to Canada, never really live here for any period of time, go to another country, have your kid, and that kid is gained citizenship. That's already the case. What this bill changes is that if you are a Canadian citizen, you have to have some sort of connection to Canada in order for your kid to gain citizenship. So they need to live here for roughly 3 years, something around that date. But what it was before is that if your grandmother, it worked so much worse than people even realize. So say your grandmother was born in Canada, Canadian citizen, and then moves to India. She moves to India, has a kid. That kid could get citizenship. Plus, if that kid has a kid, that kid could get automatic citizenship. That was before the bill happened in this country. Before Bill C-3 happened, that is the way that it worked, and it seems like nobody was talking about that. But the second this bill came up, now it's just first-generation children. So your mom has you in a different country, but is a Canadian citizen. You can get citizenship as long as they've lived in Canada for 3 years, which seems like at the very least an improvement, and it's moving in the right direction. It's better than what it was. It's not perfect, but I think that's true compromise, where neither side should be happy about this, where you think that the person should be born in this country in order to get citizenship. That seems like the way that most of the world works, but at least it's better than 2 generations removed from a Canadian citizen also getting Canadian citizenship. So that's pretty good. Second generation abroad shouldn't get Canadian citizenship. So that's better. This is actually a stricter policy on citizenship. So I think this should be praised as a good thing. But according to everybody online, when you look at this, because nobody can read through this, because it's actually not that hard. It's a little bit confusing because it's written in legal jargon. But if you get the basic part of this, there's two parts to it, where if somebody is their parents were Canadian citizenship, or they had Canadian citizenship and they died before you were given citizenship, before this you weren't given any sort of passport, any sort of way to get citizenship because your parents were dead. Now you're automatically given it. So you could make the argument. I don't hear anybody talking about that. Nobody seems to give a shit about that part of the bill. But citizenship despite death of parents. So that is one of the main things that I could hear an argument for, but I don't hear anything. The next one, and also this goes back to something like 1947. So if this happened in anywhere prior to 1947, you're already given citizenship. So all these people who were kind of lost and they never got their citizenship because of that, because a parent died either during childbirth or recently right after you were born, you weren't able to get citizenship. Now you can, and you're actually automatically given it. I don't think you have to do anything, or it's probably an app that you can download and a few buttons, and then you're given it. But now the second degree citizenship was the issue that most people took umbrage with, and now everybody is just glazing over that and saying, oh, well, now somebody can live here for 3 years, move away, and have a kid, and that kid's given citizenship. That was already the case without the 3-year caveat. So I don't understand what the problem was. It's a very weird online discourse that's going on because people seem to be lost about it. People can't be bothered to read this. They're just going to read a headline, which, you know what, I'm guilty of all the time because I'm an idiot. So basically, I think the problem is that you don't necessarily, this would be the other side's argument, you don't necessarily have to be a full-blown permanent resident of Canada. You have to be here for 3 years. So going back to what we were talking about before with the self-reporting refugee status, is that, and the backlog of people not being able to, and the 50,000 or so people that are on the run right now, basically the hole in the logic where everybody has a problem, and honestly, I do too, this is the biggest flaw that you can obviously see, is that the refugees that are here technically legally, but with no background check and they can do it themselves, are now here, and if they can make it to the 3-year mark, they can go back to their country and have a child, and that child will be given Canadian citizenship. So that's the area that we need to start working out from. That is obviously the flaw in the system, and we can't have that. It needs to be addressed that there is a gaping hole that you can use to manipulate the citizenship process here, and nobody seems to be addressing it. So honestly, it's a shitty bill. It's not great. It's not great for most Canadians, but it wasn't great in the first place. I think that's the problem that people weren't seeing, is that a Canadian citizen could have a kid, and that kid could have a kid, and those people were given automatic citizenship. That was the flaw in the old system. This bill solves that, but it creates a new problem of people that aren't even citizens, that have just been, there's a connection to Canada is the phrasing that they use in here, where you have to have lived in Canada for 3 years. There's some half-assed form of assimilation that you could argue that they're technically Canadians because they've lived in the country, they have a connection to the country, and then they can go back to wherever in the world and have a kid, and that person is given Canadian citizenship. That's a flaw. It just seems like they they're playing whack-a-mole with this. They knocked out one flaw and another one popped up, and it should have been glaringly obvious when writing this. But hey, honestly, might be a step in the right direction, but all it's going to do is slow things down temporarily, and then we'll figure out the loophole, and it'll continue going. So I don't like it. I'm not a fan of it. I think we have a lot bigger issues to be dealing with, including this new report that came out where 23,000 people in Canada just this year died while waiting for medical care, probably emergency rooms, doctor's visits, anything like that, because our hospitals are so backlogged. Now, if we're adding citizens and refugees to this system, will that get better or worse? That should be the first question in any sort of argument about this, is that if we add more people, if we're letting in more people with very, very loose restrictions, and they're going to a hospital and they're forced to be treated and then they can't be tracked down afterwards, will this hinder that the process? Will it make things go faster, or will it make it worse? Will there be 23,000 people in Canada that died because they couldn't get medical treatment? Now, I have my own personal stories about this. I've gone to the hospital. I was going through probably my first ever allergic reaction. I took penicillin, which I wasn't supposed to take. Honestly, my fault, my bad. I am allergic to penicillin. I learned that then. But I was having an allergic reaction. My throat was closing. I couldn't breathe. I was puking through a pinhole in my throat. I was almost like projectile vomiting because my throat has closed to about the size of a little smaller than a quarter. And I was having a hard time breathing. I kept vomiting through this tiny little hole in there. And they kept checking because they have a triage system. They kept checking, and they said it needed to close more. My throat needed to be almost to the point of being closed, probably about the size of a penny, in order to, no, I think they said dime. So a little bit smaller than a penny. So the size of a dime, it needed to be a little tiny hole that then they could bump me up into the system. I sat there for probably about 8 hours, vomiting on myself, laying in the disgusting hospital bathroom, couldn't get treated, and eventually I just went home. I just said, I'm not going to do this anymore. I don't care what happens to me. I can't do this anymore. I would rather die in my own bed than laying on a disgusting hospital floor. And I just left. I just went home, and luckily it turned out to not be fatal, and I just rode it out. I couldn't breathe. I was doing like a for like the better part of 15 hours or so. And eventually it started to work its way out of my system, and I was fine. So I guess that's the approach that we're taking to the medical system here. I really, really dislike the argument where people from outside of Canada say, oh, well, look at Canada's system. They clearly have it figured out. It's free healthcare. There's nothing free about this. I don't like the argument that you get what you paid for because this is free healthcare, so you're probably going to have to wait 15 hours with a closing throat. That's a dumb argument because not only are we paying for it, you're paying more than the average insurance rate in the States. You're paying, and it's forced. Even if you don't use it, you don't get to decide if you want it. You don't get to pick a better insurance plan. You don't get to pick your provider. You barely get to pick your doctor. You just have to get one. It's like when somebody new comes in and they open up a practice, there's a waiting line around the block to get in there because nobody can get into the nobody can get a family physician. It's next to impossible. The American system is there's so many people priced out of getting a doctor that you can just decide. You could pick. It's like picking what fast food you want to get. Sometimes there's a line. If you don't like the line or the service, you can go to another one. That's not what you get here. You get what you pay for. We have a thing in Canada called death panels. It's not actually what they're called. They probably call it something light like happy, fun, bye-bye time because they like to lighten the blow. But basically what that means is they look at the cost of treating you versus your life expectancy. And if those numbers get a little too close and it costs a little bit more and you're a little too old, then you just die. We're not even gonna try to treat you. It's just like you're dying of like your lungs collapsing, or you have cancer or something like that, and that's gonna be too expensive because you're in your 80s. Doesn't matter. You're either gonna have to fly down to the States and pay out of pocket, and also you don't get to opt out of paying for the Canadian healthcare system because we need that money too. Then you're gonna die. That's all you get. So there is a panel of people who get to decide if you're worth even trying to treat in Canada. So it's not a good system. This is terrible. This is the report that we're getting, is that 23,000 Canadians died waiting for medical care in the past year. This is just coming out today. Last year, I think it was somewhere in the 13 to 15,000 or something like that. So it has gone up an exponential amount, almost doubled in a year, that people are just dying, and that is only going to get worse in the way that we're going. When you add more people and the services are open to the public, they have an obligation to treat you, and then they have no way to track you down to pay, that's obviously going to be the case. It's only going to get worse. So the argument that I've heard against this already, there's already a discourse about this online, and I can beat it right now. So this is the 23,000 number in Canada. People died for medical. So people are dumb when it comes to numbers. When they compare America to the States, it's very difficult because, one, we use different measuring systems with imperial and metric. And then two, they have infinitely more people, about 10 times more people, I believe. It's something, we have around 40,000 people, and they're pushing upwards of 400 million people. Did I say 40,000? 40 million people, and 400 million people in America. Now, this is the number of people where they argue that the American system is much worse. Oh my God, you don't understand. 23,000 people dying because they're waiting in hospitals and nobody can treat them, and they're getting kicked out. They're just leaving the hospital because they can't find treatment. Oh, well, that's nothing compared to the 44,000 people, working age people in America, where they should be healthy, but they can't get treated because they have a lack of health insurance. They can't get health insurance. Either their job doesn't provide it, or they can't afford to pay for it, or probably more than likely, they just chose not to. Because that seems to be the case for a lot of people, where they prioritize other things in their life to pay for rather than pay for health insurance. Where in our system, I'm forced to pay for it, whether I use it or not. I've been to the hospital a handful of times. They've rarely ever helped me. I don't have a family doctor. I don't have like my own doctor that I can go to. I just let it ride, and hopefully if I get sick enough, then they will treat me, because that's the only thing that I can do. I can't get checkups. I can't do anything. It's not like dental is covered. I have to pay for my own dental care. So there's a lot of things that aren't covered here, like your prescriptions, pretty much anything outside of a person looking at you. So if you got to get any sort of outside scans, blood work, things like that, all have to be paid for out of pocket, plus the about 11%, anywhere from 11 to 15% of your taxes that you pay that go directly towards this. So that's a terrible system. So there's this little thing that people seem to forget about called per capita. Per capita. Now, how dumb do you have to be to use that as a comparison? It's like, oh, it's double. That number bigger than first number. Canada 23, America 44. That's a bigger number. That breaks down to about, out of 1 million people, the amount of people that will die. So you line up 1 million people that all need to go to the hospital, 564 of them will die because they can't get treated in Canada. That's, you want to take those odds, that's pretty good. Compared to the uninsured population in America that There's probably a portion of them that chose to not be insured. Some of them can't afford it. Some of them, it's probably one of those two. Honestly, that's pretty much the two. That's, you take 1 million people, 125 of them won't be able to, they'll die because they can't get medical insurance. Now, that's way better odds. It's way bigger of a chunk of the population that's going to die where they not only didn't get the opportunity to not pay for it, that's the part that everybody is missing, is that they got to keep that money in America where they could pay for groceries. Maybe they didn't have to send their kid to school hungry. Maybe they could, there's a lot of different things that you could do with the money that you don't pay for health insurance with. Then you die because you don't have health insurance. Some people like to live like that, but it's 125 out of every million will die because they don't have the proper health insurance, as opposed to 564. It's triple to quadruple the number of people will die because they're waiting for healthcare in Canada that they already paid for. They were forced by threats from the government that they will throw you in jail if you don't pay your taxes. They will die because they can't get medical treatment. Our healthcare system is broken. There's nothing to do that goes even further than that. So in the last year, the amount of people that have just left, just like what I did when I went into the hospital, my throat's closing up. I felt like I was going to die. I'm vomiting everywhere. I'm having an allergic reaction where my throat is closing. 1.2 million people left the hospital without getting treated. They just waited. They waited, probably waited the better part of 10 hours, and then just left because they couldn't do that. Now, there's a portion of those people that just went in there because their leg fell asleep, and that's it. But that's the world that we're living in now, where we think that's okay. There's too many people in there. It's understaffed. The people that we're bringing in as refugees and immigrants aren't fixing the problem. That's what we were promised here, is that we're bringing in highly skilled people that are going to be doctors and engineers, and they're going to improve society. But all they've done is hinder society, where now double the people of last year have died because they can't be treated in the hospital. This is not a good system. Quebec sued the government, I believe in the 90s or early 2000s, in order to be allowed to open privatized healthcare facilities because the exact same problem happened there. So something needs to be changed. We need to fix this problem. We can't be letting this many people be homeless, this many people be dying because we're having open use sites where you can just get free drug paraphernalia to do drugs. And what do you think that does to the healthcare system? What do you think that does to the people that are the EMTs and the first responders and the nurses? Do you think that helps? Because they might survive because they're getting Narcan and stuff, but that's just another burden on the taxpayer because we can't afford to do this. You have to just start figuring out where we can solve these problems. We need a solution. It's only getting worse. So how do we solve it? We need less people. We need to stop doing this until we can build up services to where there's less than 100. That's where it needs to be. There needs to be less than 100 people dying because they couldn't get treated. When we can get to that number, then we can start letting more people in. That's the main part of the issue. So, speaking of first responders, I was looking at this. This is a map of where I used to live. It was Barrie, Ontario. I used to live in the heart of it, where I lived next door to a fentanyl dealer. That was his prime source of income. It was a slumlord who just gave whatever they wanted to these people. They had a pizza box as a front door window because they couldn't afford to fix it. The house was slapped together. They had rats. I don't think they ever actually took out their garbage. They just pushed it down the basement stairs. And if you look through their window, which was facing my house, you could just see rats scurrying around in in the basement, and it was just trash everywhere, ripped apart. My dogs, it was just like a window to look at rat infestation. They would look at the window and they'd go like, "Oh my god, what's that? Oh, what's that?" They thought there was a bunch of chew toys down there. It was disgusting. I hated it. You could see them crawling around. One time I came home from I think I was camping or I was away for a weekend or something, and I came home and a couple of the rats got into the garbage can that they leave outside of their house, and there were two of them in there, and they fought to the death, and the other one ate half of the rat, and this feral-looking, disgusting rat was just in the bottom of the garbage can covered in rat guts because they got trapped in there and they couldn't get out. We used to wake up and there you would hear like a tapping on a window, and there's a person out there, and they'd open their little sliding glass window and they'd hand fentanyl out the window to a person who would then just collapse into the front yard or do that fentanyl lean in the front yard outside of my house. I would have to walk by them and go, "Hey, how's it going?" They do. That's the kind of area that I used to live in, to be in perspective. One time there was a pregnant lady that was doing that. So great services that are going around in my neighborhood. The community really comes together and does that. But I was looking at this map. They have a community safety data portal that they just opened about 60 days ago. It's a crime map that shows all the different crimes in the area over the last 60 days. So I had a personal experience with this, which I think is when I was a kid, this didn't seem like it was that big of a deal. But it was. I don't know why I didn't care as much, but thinking back on this, it was disgusting. So my mom was, let's call her a single parent because my dad left and went to do OnlyFans. He was still around periodically. He would come by from time to time, but he essentially left, and I was with my mom. I lived with my mom, and we moved to this downtown house that was next to a fentanyl dealer. And we were living there. It seemed, in my eyes, was pretty comfortably, but I think my mom sheltered me a little bit because we weren't. We were probably struggling pretty bad. We didn't have any extra money anytime. But what would happen is periodically, I didn't realize what this was, but looking back on it, I'm now realizing what was going on. People would come to the door and they would knock on it and they would ask for a random person that doesn't live there. They would knock on the door and I would open it. We had one of those like hotel chains that I used to keep closed when I was like 14, and I wouldn't open the door fully. I would like unlock the padlock and keep the little hotel chain, and I would open the door, and somebody would go, "Is John there?" And I would go, "No, there's no John that lives here." And they'd go, "Okay." And there's like a group of men standing on the porch just looking for a guy that doesn't live there, that's never lived there, that we never got any mail for. They would just ask for a random name, and then they would leave. And then a while later, they would come back. Once we got, once security cameras were, like those Ring cameras and whatever, were readily available, we got a couple of those. And you would see people walk up to the door and try the handle. And you'd see them look down at the door, try and get in, and then they would leave when they couldn't get in. And I don't know why I didn't find that more concerning, but I probably should have, because my mom was a single parent, just a woman living there with her Marfan disease-ridden kid who couldn't do anything. What the fuck was I gonna do? I look like an AIDS patient. There's no way that I'm gonna be able to stop anybody that breaks into our house. There was this one time that I left to go to there's a little hill that's beside my house, and I would go and snowboard on it. I had this piece of shit snowboard that I slapped together of broken pieces from my other friends' snowboards, and I basically Frankensteined a snowboard together, and I would go to this hill and go and snowboard to it after school. And I was there, and then I get a frantic call from my mother. She's freaking out. She's going, "What the fuck happened? What is this? what's going on? I was like, what did you do? And I was like, I don't know what you're talking about. She's like, somebody broke into the house, and she's blaming me or my friends or something like that. And I'm like, I don't know what you're talking about. I'm down at the hill. She's like, get back here. And I come back to the house, and our side door has been kicked in. It's collapsed. The whole frame around the door is broken. Our door is falling down the basement stairs, and she's crying. She's sobbing, and she doesn't know what's happening. So apparently they came into the house. They walked through. They stole, at the time, the Nintendo Wii, which is crazy. I couldn't believe it. Loved that Wii. It was a staple of my house. Stole the Wii. Stole my mom's engagement ring. Stole my mom's laptop. And a couple other little earrings and little things around the house. They didn't steal anything of mine because my room was so messy that they couldn't get into it. I remember at the time that I had so much shit all over my floor, including Guitar Hero and Rock Band controllers. The drum set was like pinched behind the door. There's like clothes everywhere. I never cleaned up my room, and honestly it benefited me because I know what happened. I can guarantee what happened. I couldn't even get into my own room. You had to like push the door and then skinnily AIDS patient slide in through the door. And I did that on purpose because I didn't want my mom going through my room because I was probably in there smoking weed. So I knew she couldn't fit through the door, so I just slid in that way, and that way she would never be able to get into my room. So I did that on purpose, and luckily they didn't steal any of my bongs or the PlayStation. So, you know, fucking perfect for me. So that's probably why I didn't care. But looking back on it, how terrifying that must be for a single parent to be living next to a fentanyl dealer, next to the downtown core where all this shit's happening. There was somebody who got shot on their front porch around the corner from my house, and she's freaking out because now it doesn't feel safe. We got people to come and reinforce the doors, added extra locks, got, I think, some cameras. That's probably when we started getting more cameras because it was terrifying. And I remember my mom being so sad about this. She, I think, still thought it was me, so that's why I wasn't as upset by it, because she did keep blaming me. She was thinking it was somehow one of my mom's friend or one of my friends that did this. And I'm like, no, this isn't something that I would do. Why would I break into my own house to steal stuff? Why would I was just going to steal stuff. Why wouldn't I just steal it? I'm going to stage a robbery. So what, you're not going to blame me? That's, if stuff just went missing, I guess you would blame me, but still you're blaming me now. So what did that do? So that would be terrifying. Now, this map here is a map of the area, and these circles are break-ins over the last 60 days. So this is too much. These are break-in enters into the house. This is not it's a big enough town, but it's not a very big town. It's not like downtown Toronto or the surrounding areas like that where you would think that this kind of thing is happening. But this is 46 break-ins in 60 days. So about almost one every day. 1.2 something a day. Are roughly. So basically you're going to have a break-in a couple of times a week in the area that the police have to come to. There's thefts, robberies. You can go through all of these things where this is what's going on. Now, it's only getting worse when you look into all of the areas. There's drug crimes, there's trafficking, there's nonstop pictures being put up everywhere of people that have just gone missing. Now, I don't know who thinks that we're improving any time, because what I'm talking about when my house was broken into, that was years ago. Probably 15, maybe more. Yeah, it has to be more than that. Years ago. And that has only gotten worse over time. Now, obviously, as a metropolitan area gets bigger, the crime rate is going to get worse. But we can't seem to stop it. And now the government is taking away all of the guns. You cannot purchase a handgun in Canada anymore. So how was somebody like my mom, a single parent who's living alone, they're there by themselves with no way to protect themselves, supposed to stop that? Because I remember after that, I started getting shaken up. Now, when these people kept coming to my door after the fact, where they would knock on the door and they would ask for Peter, and I would say, no, there's no Peter here, I realized that they're casing the house. They're knocking on the door and trying to figure out if somebody's home. And if nobody's home, then they're going to try to get in, kick in the door, break a window, and then just come in and steal. That's what was going on the entire time. I just never realized it. I was just too dumb to figure out what was going on beforehand. And that is really, really scary. I would rather the single mom have to live with the trauma of shooting somebody that came into their house, and that should be the case. When somebody breaks into your house, you should shoot them. That's if they die, they die. That's the price of admission for breaking in. If you're willing to risk your life to break into somebody's house for a Nintendo Wii, that should be on you. We shouldn't do what the police chief in the greater Toronto area says to do, where they say, lock yourself in your room and call for help and hope that they get there in time. That shouldn't be the way that it is. When somebody breaks into your house and threatens your family and makes you feel not secure in your own home, you should have the ability to stop them. The only way for a single mother with... It's not like she exercised or did jujitsu or anything like that. There's no way for her to stop 3 men breaking into her house. What is she supposed to do? The only possible way for her to have stopped this, if she was there, was with a gun. She's not going to be able... There's no equalizing force that's going to be able to make my mom, a 40 to 50-year-old woman at the time, be able to prevent this without having some sort of firearm. And now the government has taken that away from you. So what we have here is a collapsing healthcare system. We have a refugee system that can just, you can allow yourself into the country. When you're not approved and supposed to be kicked out of the country, they can't find you. And if you break into somebody's house, you will get charged if you hurt them. So what does that create? That creates an unidentifiable society, group of people that can just break into your house, disappear into the night, never be found, and if you do something to them, then you'll be in trouble. So that incentivizes people to do that. That's like when you figure out at the mall that you can't touch them. Where my girlfriend works, they'd have to take training on if somebody's stealing. Just say, hey, give that back. And if they say, no, go fuck yourself, you have to go, all right, have a good day. Knock yourself out. What does that improve? That's only going to tell people that if you don't try anything, if you don't steal, then you're the idiot. Because you should go in there and steal and know that they're not going to be able to touch you. The police are never going to be able to find you. And you just get free stuff. And they'll pass the savings on to the actual people who pay. Because that's how it works now. It's a terrible way to live. We should be way, way tougher on crime. These numbers, you shouldn't be getting almost 1 break and enter a day. That means that there are, in the last 2 months, there has been 46 break-ins. That means there's 46 families that now don't feel safe in their home in the last 60 days in this tiny little area of a town. The town is 5 interchanges on the highway. It's not very big. So that means out of all the people, there's 200,000 people in there, and there's 46 of them every 60 days. So for the next year, you're gonna have, I don't know, like 200 or so break-ins, 200 families that just now don't know what to do when somebody comes into their house. They've lost items, they've lost security, and they don't know how to get that back because they can't get a gun. So Canada is a fallen society. There's no way to get this back. And if they come in to your house and they hurt you and then they disappear into the night because they're a refugee who lied on their refugee form to come in, when you go to the hospital, you'll be lucky to be treated. So if you die waiting to be treated in the hospital because you were stabbed trying to protect your home, that'll be because of the way that we've decided to let our government run. We've chose this government. This is what we chose, and it's only gotten worse. So I don't know how to stop it. It's becoming sad, and I don't know how to fix it. I wish I could. I wish there was some way that we could figure out a way to downsize the government while solving these problems, because throwing money at it never seems to be the answer. We need less government money in order to figure out the way to solve these problems. We need less money so we can put the money towards things that actually matter. You need to start to prioritize. The government always looks at you and says that you need to tighten your belt, and you need to make sure that your budget is a shoestring because things get tough. But the government never seems to be that. The government says we're going to give money to every single country, all these humanitarian things. We're going to solve the war in Ukraine, and we're going to give money to Israel for a while they bomb Palestinians, and then give money to Palestine to rebuild. It makes no sense. It doesn't make any sense. We need to figure out how to solve our own problems. We need to give more money back to the people. We need to let people be self-sufficient. That would include taxing them less, letting them own firearms to protect their home, letting them choose their own healthcare providers and not forcibly make them pay for it. They should pay for it. We should pay for a healthcare system. But if you don't want to and you're not using it, you shouldn't have to. It shouldn't be forced upon you to pay for something that doesn't work and won't help you when you need it. So I disagree heavily. And that's why we need to, if I would vote for Danielle Smith for Prime Minister of Canada, because she right now is the Premier of Alberta. And right now what she's doing is a step in the right direction, but I disagree that this is enough. That's the worst argument you can get it. They have a 5% tax rate in Alberta. When their teachers go on strike, they force them back because they're already paid enough. They're glorified babysitters, and what they're doing is honestly not helping society at this point. When you have a society run the way that we're run right now, I don't think the education system throwing more money at the teachers that have been there for 10 years is going to fix anything. But Danielle Smith is the Premier of Alberta, and what she's come out with right now is a great way to be, because the only way that you can figure out who people are and what they're about is giving them the freedom to talk about it. So this is the new policy that she's put in place here.
The Regulated Professions Neutrality Act. This is common sense legislation that would recognize that everyone should have the right to express their personal views freely. No professional should fear losing their license, their reputation, or their livelihood because of a personal opinion, a social media post, an interview, or open dialogue outside of working hours. These changes come after one of the most notable cases of professional regulators punishing an individual for comments made outside of a professional setting, and that is Dr. Jordan Peterson. Dr. Peterson was sanctioned and ordered to undertake a so-called re-education program in order to maintain his credentials for statements he had made outside of a clinical psychology setting. Similar notable cases have involved nurses, doctors, and teachers that have been punished, sanctioned, or have had their licenses threatened for comments that they have made on social media, at protests, or even at meetings of local city councils. Are regulators still focused on public safety and professional competence, or are some of them overstepping to enforce ideological conformity and to silence public discourse?
So, here's my take on it, and I'll be quick. The way that this is going is the right direction to go. I disagree that you should force people to keep people in a position if you disagree with their opinions. So I think this is correct, but for the wrong reason. So basically, yes, you should be allowed to say whatever you want. That's how we should all work. The only way that you can figure out what somebody's about is by giving them open dialogue to say whatever they want. And then you can be the arbiter of whether or not that person's a good or bad person. You should say whatever you want. That's kind of why I've built an entire network around it. You could scream the N-word for an hour straight, and if nobody listens, that's your fault. That's the way that it works. If you sound like an idiot, that's the open hand of the free market. You sound dumb, nobody's going to like you. That's how it works. If you want to say whatever you want, you think that that's going to influence people, feel free to say whatever you want. Now, I disagree that if you say some things that your employer don't like, that they should be forced to keep you. That's the other end of this spectrum. They should be allowed to fire you for things that they don't like. But I don't think that you should be forced to stop saying them. It's very confusing. It's a very dumb, confusing take. But basically, what you should be able to do is say whatever you want. That should be this only works for people in positions of power, like school teachers, doctors. This is what this law is about. It's not about freedom of speech for all the people, which is kind of what we should be working towards. We should be working towards anybody can say whatever they want, but that doesn't give you freedom of consequences. You can say some horrible things, and your employer can fire you. That's how it works. And if there's a big enough backlash for the reason why you fired them is ridiculous, that's the cycle that we can go through. But you shouldn't be fearful of having the wrong take. So that's why I think this is going in the right direction. Where Jordan Peterson's case was that he wasn't going to call outside of a professional environment, saying that they weren't going to call a she a him. It was about transgenders. So I think that's the way that the cookie's going to crumble. I think this is a step in the right direction. Alberta is the only province in the country that seems to be run correctly. So I'm hoping that a few years from now we can get somebody like Daniel Smith in the prime minister's seat, because right now everything has gone to shit. Everything costs more. Our tariffs have gone up. They haven't gone down, even though that's what our government was run on. That was the platform that the Carney government ran on, was that they were going to be tough, elbows up. We're going to fight the Americans, and we're going to get lower tariffs. We're going to get a better deal than we ever had before. We got a worse deal in every single sector, and it's only getting worse. So I think that that's the way that something's going to go, where we need to give more money back to the people. We need to stop overtaxing them for systems that don't work. And then we need to stop giving money to people that haven't earned it. If you're not putting in enough money, you have to build a safety net before you get to use it. I think is the best summary of today, is that you don't get to just use the safety net that other people have built. That's not fair. What you should be doing is, from the time that you're 14 or whatever and you get into the job market, you should be building that safety net. So when you need it, it's there, and it should be a net, not a hammock. You shouldn't live in that safety net. You shouldn't just use it forever. It should be there to catch you, and then you don't die, so then you can continue on and you can get better from there. And instead, what we have is just this pillow fortress that we've created, and nobody gets to use it other than people that didn't make it. And that's not fair. So hopefully that makes sense. Maybe I've been yapping for so long because I'm exhausted. I have a lot of work today. I've had a very busy week. I need to go out there and I need to put my nose to the grindstone because 40 some odd percent of my earnings need to go directly to some refugee. And I know that they need it. So I got to get back out there and work more. I have a very long week. I'm going to be putting in overtime for the CRA so they can get enough tax money to absolutely fuck up the country with. Thank you, everybody. I appreciate it. This has been Politiocracy. I am your head Politiot, Ryan, and go subscribe to the YouTube channel. If you want anything that's been cut out of this episode or longer episodes, go over to podcastergay.com because podcasts are gay. If you're listening to any sort of podcast that isn't on this network, they absolutely suck because they don't have the freedom to do what they want. They're all catered to YouTube and all the other tech oligarchs that are out there. There are milquetoast, watered down versions of what they used to be. Here you can be as dumb as you want. You can have the hottest takes on the planet. So come over, join the fun, subscribe to the network, subscribe everywhere that you can. You send me some links and articles that you would like me to go over next week, and I will see you next Wednesday night on Politiocracy.